I'm Dr. Calliope, and if you'd like to just take a seat, we can get started right away. Excellent. I'd love to start by taking your pulse. Do you mind if I do that, and do you have a preference as to which arm that I use? Wonderful. We'll just do right here. So what I'm going to do here, I'm going to take my first two fingers and put them underneath your thumb side of the wrist, and there we can get a good sensation of the pulse here. This is the radial pulse. I'm going to place my fingers here, and we wait approximately 15 seconds. That way we can multiply the value by 4, and then we can get an easy pulse rate without waiting the full minute. Good. Excellent. Keep breathing normally. There we go. Good. So, pulse rate. Good, and we also have our respiratory rate. So that is 12 breaths per minute, which is well within normal limits. See if I asked you to allow me to measure how many breaths you take, you're likely to change it up a little bit. So we do it when you're not thinking about it. I'm going to just check the temperature of your limbs. So we're going to feel the joints and the skin, see if anything is too warm, too cold. Maybe there's some clamminess. So I could just have you hold out your arms here. Use the backs of my hands to feel along the limbs. If you had any issues with your joints, and do you feel like your hands get quite cold or quite hot? Do you feel like your skin gets very cold or very hot? Good to know. Warm to the touch with normal, dry, not clammy, not sweaty. And let me just check your nails real quick. We'll look for any abnormalities in the nails or capillary refill. Make sure our circulation is good. Pressing on the nail, seeing it blanch, and then letting the blood come back into the finger. And we're looking for color changes as well, more particularly cyanosis, which is a bluish tinge. And with that, if I could have you just open your mouth, please. And I just want to look underneath your tongue. Just underneath your tongue. There we go. And can you stick your tongue out? Excellent. And put it back in your mouth. Let's see. Just the lips are good. Everything is a normal color. We are going to be looking at the chest to start. We are going to be using inspection, palpation, percussion, and auscultation as our main techniques, our main manual diagnostic techniques. So I'd like to just take a look at you. And we are looking for any pulsations, for example. We are looking for any abnormalities in the chest wall. Do we have the sternum caved in, caved out? Do we have a sort of we can see when there is hyperinflation in the chest. Good. I'm just going to feel around a little bit here. Just using my sense of touch to get a greater understanding of what's going on. There we go. Looking for symmetry, that both sides symmetrically expand and contract. If I could have you just take a few breaths for me. Deep breath in and out. There we go. Deep breath in and out. Let's see, one more. Deep breath in and out. Good. Okay. Alrighty, so what I am going to do here, I'm going to have you turn around so that I can look at your back. We're looking for some similar things. We're looking for the symmetry. I also want to look at your spine, look for scoliosis and excessive lordosis or kyphosis as well, which basically means your spine is either too much to one side or it's too forward, too back. If I could just have you just turn away. There we go. Let's look here. Look at the spine. It is midline here. If I could have you bend forward, this makes it a little easier to see. And very slowly come back up. Good. Okay, so both sides have been even the whole way here. Good. And if I look at you from the side, we're looking at the curvature of the spine. So normally it's got this sort of S shape to it, right? Well, sometimes it curves a little too much in. Sometimes it curves a little bit too much out. But your spine looks to have normal curvature. Good. Now I'm going to put my hands on your back and we are going to test the chest expansion. What that means is as you breathe in, my fingers should pull apart on your back symmetrically. They should be going the same time, same distance, and then coming back in. So, this will be a little tight here. If I can have you take a deep breath in and out. One more deep breath in and out. Here we go. Very good. Our inspection looks all good, and we can start getting into more of our palpation. So I'm going to feel around. We'll start with your back. While we're here, I am going to feel around for any tenderness, so do let me know. If anything is painful at all, we'll feel for any masses, anything that shouldn't be there. Good. Okay, and everything feels normal here? Excellent. Now we're going to do a little odd test called tactile fremitus. I'm going to use my hands and I'm going to put them on your back. And I have you say the words 1, 1, 1. And I'll be able to feel the vibrations in your back and see if there is possibly any sort of obstruction to the larynx. So I'm just going to put my hands on your back here, and if you could just say 1, 1, 1. Good. Hand move down. 1, 1, 1. Good. I doubt you have a collapsed lung, but this also can be used to assess for COPD. Anything that can obstruct the larynx. 1, 1, 1. Okay, down. 1, 1, 1. And 1, 1, 1. There we go. Now, if I could just have you turn back for me. Now we're going to do a little palpation with the heart. So we are going to feel for what's called heaves and thrills. So heaves, I should be able to feel under the heel of my hand. It's going to be quite forceful. And thrills are a sort of palpable heart murmur that I can feel with the flats of my fingers here. I'm going to put my hand on your chest. Just breathe normally here. And we're going to feel around for any of that force in the chest. There we go. Good. Okay. Then we have the flats of the fingers. I'm going to feel over chest here. Good. Now the apex beat here, I am going to just measure from the middle of the clavicle here, and then we have the 5th intercostal space. Intercostals being the spaces in between the ribs, those little muscles there. So I'm just going to measure the spaces and meet my fingers together. Pretty easy, right in the middle of the clavicle. But then we come to the sternum and we measure 1, 2, 3, feeling into those grooves there, 4, 5. If I put my finger there, middle of the clavicle, and just match those up, just going to feel right here. Okay. And that's where it should be. Good. Now we have quite a bit of percussion to do. So percussion is going to involve me using my fingers to tap along your chest and your back. So what I'm doing is, if you've ever tapped on something that has liquid in it, it's going to sound different than tapping on something that's empty. So that's what we're doing. We are listening for the sounds that come back. Is there an area that feels like it's filled with fluid? Is there an area that feels like it's filled with air? Does it have a normal resonant tone? Does it have timpani? Does it have a dullness to it? All these different little qualities we're going to assess as we percuss on the chest. So we are going to just map out the chest in this step ladder like formation, comparing one side to the other. So we're going to start right here. Good. is what's called a resonant tone. If we had dullness, that might suggest fluid or solid mass. See that in pneumonia, for example. Do you mind just lifting your arms? There, and then I can get the sides here. Then if we had hyperresonance, that could mean asthma or emphysema. Then we have tympany, which sounds like a drum, like the timpani drum, and that could mean a collapsed lung. And then we can get a flat tone. So it's kind of hard to demonstrate what all that sounds like, except for the hyper-resonant tone. So let's see if I can get that. If you puff out your cheek, do you hear that sort of really echoey tone in there? That would be our hyperresonance. It sounds very echoey in there. So I'm going to have you go ahead and just turn to the other side so I can do your back, and we'll listen for those sort of tones. Okay. Good. And naturally, the sounds should get deeper as we go down anyway. Good. Now, while you're here, we're going to switch to auscultation. If I can untangle myself. There we go. So auscultation means listening. We are going to be listening with the stethoscope. And the stethoscope has the prefix steth or stetho, and that means referring to the chest. So even though we call this your back, this is the posterior chest wall. So here, we're going to start with the lungs. I'm going to put the diaphragm right here, this little bit, the diaphragm on your back. I'm going to have you take a deep breath in and a deep breath out. Deep breath in and out. Good. Deep breath in and out. If we could just keep that up, inhale and exhale. Inhale, exhale. So, what we're looking for. Exhale. Are things like wheezing, which is classified as a musical tone, and if you've heard someone wheezing before, almost a little bit sounds like an instrument. Deep breath. We have bronchi and out, which sounds very bubbly. It sounds like bubbles, like fluid. That is fluid in the airway. Deep breath in and out. Good. If I can have you just turn back towards me. Good. And deep breath in and out. Then we have crackles, which can be coarse or fine. Deep breath in and out. Stridor, which sounds like something is obstructing and has a bit of a musical tone to it too. Deep breath in and out. Good, and if I could just have you hold your arms up again. Deep breath in and out. Deep breath in and out. Inhale. Exhale. Inhale. Exhale. Good. And again, like the different percussive sounds, I can't really tell you what they sound like except for the crackles sound like if you rub hair together. That's what that sounds like. That sort of crackly sound. Lungs sound good, and we are going to move on to the heart. So with the heart, we are listening to the valves open and close, essentially. It's kind of funny because it sounds sweet when you're listening to someone's heartbeat, but it sounds a little less sweet if you're listening to someone's heart valves open and close. It's a little weirder. So we're starting here at the aortic valve. Taking a few seconds here, listening to it open and close. And then we can go to the other side of the sternum. We'll do the pulmonic valve here. Good. Down a bit. Do tricuspid. Good, and over, we'll do mitral. Okay, and then I'm going to come back right here, and we'll get Erb's point. Good, good. Now, I'm going to do that again, but we're going to turn to the bell. So the diaphragm is good as your sort of all-purpose listening tool. This one is good at listening to higher frequency sounds, but the bell here is better at listening to our lower frequency sounds and can detect heart murmurs a little bit better. So we'll come back to the aortic valve. Good. Pulmonary. Tricuspid here. And the mitral way over on the side there. And we'll come back up to Erb's point. Okay, very good. Now, before I take the stethoscope off, we've got a couple more spots to hit. First, we're going to listen for any bruits in the carotid artery. So this is an audible heart murmur. And I'm just going to have you take a deep breath in and just hold that. Then I don't get the sound of the air rushing through the trachea. Good, and exhale. And deep breath in and hold and exhale. Okay, very good. So I'm just going to leave the stethoscope in for a moment, but we are going to shift to the abdomen. Now I'm just going to have you lay back, and then we'll be able to look for any movement in the abdomen. Be able to see if there is any pulsation. We can see if there's any swelling, might be visible peristalsis. See any flexing, any waves. Yeah, the umbilicus looks just fine. Okay, I've given that a few breaths there. And we're going to bring back the stethoscope. What we're going to do here is we are going to listen to the digestive sounds here. Then we're going to listen for any bruits in the renal arteries. Just take a little listen around. Good. And then, so we have 2 areas to listen to for our renal artery bruits. Side and the other. And then we can drop the stethoscope for a bit. There we go. Good. Very good. Now, we're going to bring in the palpation. So the order of operations is a little bit different for the chest versus the abdomen. See, if I went in with my palpation to start, my percussion, that sort of pressure can change the way that everything sounds in the abdomen. So if I wouldn't have done that, then I'm not going to get the same sound. So we start with auscultation, move to our palpation here. So I am going to use one hand to start, and this is sort of medium pressure here, and we are feeling for tenderness, especially rebound tenderness. So for example, if I press down here and then pull right back up, does that feel tender at all? No, that's good. So rebound tenderness is something, for example, in like appendicitis, you can see that, where you press in and pull back and it hurts more when you pull back. And we're feeling the temperature, feeling if there is any guarding or any rigidity in the abdomen. Looking for masses. And let's go ahead and feel for some of our organs here. So, we have the liver on one side. I want to make sure these organs are not enlarged. Other side is the spleen. And then we can feel if the kidneys are palpable. Those feel like they're a normal size. Okay. Now I'm going to get in real deep here. I'm going to use 2 hands to really press in. I'm going to have you take a deep breath in and out. Deep breath in and out. Deep breath in and out. Okay, so now we can use percussion for a few things. Like with the chest, we can use it for finding fluid, pockets of air, gas. We can look for masses with that dull sound, or we can also map the size of the organs as well. So, I'll just have you stay still for me. Do a bit of tapping around. We can map out, for example, the borders of the liver. Good. Excellent. Okay, so we are done with the thorax. Now we're going to be moving to the eyes, if you don't mind. Okay, so let me just make sure. I've got my ophthalmoscope, and I've got my little light here. Now, we're going to take a look at the structures around the eye here. So we have the eyebrows. Make sure those are intact. You can actually experience hair loss in the outer third of the eyebrow. We have the orbit around the eye, an orbital ridge. Any pain or tenderness here? I look back, just making sure those are in a correct position, that there isn't any drooping, for example. Look at the side and make sure the eyes are not bulging. Good. We have the lacrimal gland right in here, little tear ducts. I'm going to pull down on your eyelids. I'd like you to look up. We can look at the conjunctival tissue here. Look up. Make sure that it's not overly pale, that it's not overly red. Good. And then I'm going to pull up and you look down. Good. Excellent. Looks really good. So, let me just take a peek at your pupils as they are. I want to make sure that they are circular, and we can look and make sure these are, the acronym is PERRL, for pupils equal, round, reactive to the light. Making sure that the pupils dilate and constrict appropriately with the light, and that they are of equal size, round. Good. Just keep looking straight ahead here. Good. There we go. Excellent. Let's bring out the ophthalmoscope. Now, let me just make sure that what I have here on the stool here, this is where I rest my brow. This is where I look through, and this little dial here controls the magnification. So I can do all the way 15, 20, 25, 40, plus 20, go down from there, just like that, and then we reach 0. So I'm going to put my hand on top of your head. That is so I don't accidentally run into you, and I am going to be shining the light in your eye, looking for something called the red light reflex, which, if you've seen photographs, you may have seen people that have red eyes when they look directly into the camera. That same phenomenon there. Good. And I can go behind me. Good. So this process is called a fundoscopy. We're looking at the fundus of the eye. This is the back of the eye. We're looking at the retina. What I can see back here, we have the general retina, we have the macula, the optic disc that connects the eye, the optic nerve, and we have blood vessels throughout the eye. Side. So, as part of the retina, you also have something called a fovea as well. There we go, right there, which I can't quite see. Macula, but not the fovea so much. And making sure the blood vessels look healthy, especially in people like diabetics. That's very important. Issues with the macula, you might have heard of macular degeneration, for example. Good. Okay. We're going to switch out the heads here. So we're switching the ophthalmoscope, the prefix relating to the eye, and we're going to move to the otoscope. Oto meaning ear, which you can find that in words like otolaryngology or otolaryngology, which means ears, nose, and throat. So, I have our otoscope, but we're going to take a peek at the ears first. You had any issues with your ears? Okay, anything with the actual pinna here. So this external structure is the pinna. We have the lobe, helix, tragus, triangular fossa, concha, antitragus, antihelix. Lots of little guys there. Any issues underneath that? Okay. And any itching, burning, feeling of fluid in the ears, feeling of fullness inside the ear. Interestingly enough, the part we can see inside the ear is actually the middle ear. Deeper into the head, we have the internal ear with the little structures that allow you to hear, like the hammer, the malleus, the stapes, the cochlea, our vestibulocochlear nerve. Good. So, looking at your ears, there isn't anything out of the ordinary, but we're going to take a little look inside. So, my otoscope here, I have a speculum for our sanitary purposes. I have a little guard here that I can flip up if I want. Put that down, that's my little viewfinder. Turn on the light and look through. We'll start with this here. So we pull up and over on the helix so that we can straighten out the ear canal. Very good. Now for your nose here, let's go ahead and get a new speculum that we can see up in there. So I'm just going to feel around the nose. You let me know if there's any pain or tenderness here. Okay, nothing there. Nothing along the nares, the bridge of the nose, the septum. Okay, let's look inside. I'm gonna have you tip your head back, and I'm gonna get up real close, and you might feel the tip of the speculum in the nose here. Good. And we should be able to see we have the nasal passages here. And you can see the turbinates as well up into the nose. The septum, of course. Good. Making sure the septum is midline. There are no holes in it. Do you store it all? Do you get many runny noses or bloody noses, dryness, anything? Okay. Good to know. Now let's do a little bit more percussion, but this is a little different. What I'm going to be doing is tapping along, glasses get in the way a bit, tapping along the forehead, the nose, and right along the upper jaw here. So, tell me if this is painful or tender at all. These are the frontal sinuses, frontal bone, frontalis muscle here. Coming down, we have the ethmoid sinuses, and then along the upper jaw here, this bone is the maxilla, which is why we have the maxillary sinuses right in this area. Okay, very good. So no pain or tenderness? Excellent, okay. Lastly, I'm just going to take a look at your face here. So as we've been going through this examination, I haven't noticed anything with this symmetry. There isn't one side of the face that isn't following the other side, which might indicate a palsy. And I'm just going to take a little feel here. Take a little feel. You let me know if any of this is painful or tender. Okay. Right along the cheeks. Chin. Nose. Good. Some muscles here. The temporomandibular joint. Okay, well, let me just grab the stethoscope for one last hurrah here. I'm going to auscultate the temporal arteries. So these are going to be in the temple region. So you don't need to do anything special here. I'm just going to listen. Side here. Good. Good, good. since each of those sounds normal, the carotid here and the temporal arteries, I'm going to do a bit of palpation here. I'm just going to do one side at a time. Now, keep breathing normally. We're going to feel the strength of the carotid pulse. Good. Other side. Good. And the temporal pulses here. One side. Good. The other side. Okay. Wonderful. That all feels great. So, let's just see what we've got. So we assess the anterior and posterior chest wall, the abdomen. Good. Everything looks good. Normal lung sounds, normal heart sounds. Right. Doesn't seem to be anything else that I need here. So did you have any questions at all? I feel like we explained things quite thoroughly. Yeah. A lot of knowledge that you can't really use anywhere you get to leave with today. Alright, well, let me go ahead and just sign off here. And that will conclude our examination. I'd like to thank you so much for coming in today. I hope you have a whale of a day and a good rest of your night. Thank you.